Hey everyone, in this video I'm going to show you how to find your chondromalacia of your knee. Hey everyone, I'm Sebastian at Performance Play Sports Care, part of the locally world famous chiropractors in Costa Mesa, California. Now this is part of a chondromalacia and knee pain series that we're doing here at Performance Place. And so we've covered exercises and stretches and taping and so on. So make sure you subscribe to the channel to get access to those as well. Now, Chondromalacia patella is going to be pain right around this front area of the knee here. But the problem is it's really diffuse, all right? And so I can show you a couple palpation methods we can use to find the area that we're talking about, but generally speaking, it's going to be hard to find because it's going to be literally feeling like it's underneath the kneecap. Like if my hand was the kneecap, you have to take your kneecap and fillet it off to get underneath to get to the area where you feel it. On that same note, here's the areas that we can use as bony landmarks to figure out what it is and what it's not, generally speaking. So everybody knows where their kneecap is, right here. All right, you can go around the edges of it. It's almost like a medial right there. Okay. The cool thing is, if you follow the bony landmarks, you'll also note where things are not bony anymore, which is the soft spot, which is in the front, which is the patellar tendon. If you move a little bit lower, the patellar tendon at some points becomes bony again. And this is the area where the patellar tendon inserts into the tibia, which some of you young athletes may have had problems back in the day with something called Osgood-Schlatters, which a lot of times forms as a bump in the area. Some people have it on one side, some people have it on both, and so on. Now, other spots that you can check out too, let me get a little closer to this camera just so you can see, is the joint line right into here, okay? And so if you take that kneecap and you circle it, bring it down, there's that soft spot, which is the patellar tendon, and you draw a line right across like I'm going over into my pant line, like the seam of my pants. This is the medial joint line, and this is the area where the medial meniscus lives. And if you go a little bit further into it and then drop off of this gully here, this little slope, this is the area that people call the pes anserine. Now, we started this video talking about how to find your chondromalacia patella. It's very hard because, again, you can't touch it. So what it's going to feel like is directly under the kneecap itself. And one test we can do is called a grind test, which is one thing that we do but don't really like to do with people here at Performance Place because it kind of hurts when it's actually positive. And so what we do is we take the knee into a straightened position here. Obviously, patient would be on the ground. And we take it and take the flat of our hand and just start to grind that area around. What you may find is actually as you grind the area into your femur that there's certain spots that actually go, that doesn't feel good. In that case, if it's underneath the kneecap, then it's probably something like chondromalacia patella. Now, if you have questions about what actually chondromalacia patella is, we do have other videos on this on the channel too, but we're not going to cover it in this particular video. Now, let me show you one type of treatment that I like to do, at least to take the edge off with people with patella. Is this condition is kind of one where compression doesn't feel good, which is why in the test we saw that pushing down and grinding it doesn't feel good. So one thing we can do is actually we can lift it and then mobilize it. And so this is a very basic kneecap mobilization. And so what you need to make sure that you're doing while you're doing this is not contracting your quad. So if you're accentuating a quad contraction, trying to look all muscular here, then your kneecap's going to drive itself into the femur. And so just keep it generally loose. We're going to take two fingers like you're pinching it on both hands, and then we're going to attempt to move our fingertip pads underneath the cap. Now, it's important to not go into areas where it actually hurts too much. As in the grinds test, you're making the area that's sensitive a little bit more sensitive. In this one, we're just going to mobilize into the areas where it's not sensitive, keeping movement in the kneecap as it starts to heal itself. Now, many people will need to take a little bit of time off of running, not too long, but maybe a good 5 to 7 days or so is usually a good general rule, while they start to improve the sensitivity of the cartilage underneath the knee. There are other exercises and things you can do to expedite your healing timeline. Things like side planks, side bridges, and glute facilitation exercises really work well because they take the workload away from the kneecap. There's also ones that you can do to challenge the knee and the quad and the hamstring to provide local support. Now, if you guys are looking for actually structured programs about what to do for your specific scenario, we can give it to you. Now, if you guys are looking for help, we can provide in-person and virtual services. We're located in Costa Mesa, California. Come visit us. If not, we do the virtual option. That's always good too. We have a resource in the corner which covers tips that you can use for recovering from your knee. But in all honesty, if you want to settle it out and just get it all done, just come see us. That's probably the easiest thing to do. So subscribe to the channel. Like the video. We'll see you next time.